Hello everyone, welcome back. Doctors of Reddit, what's the biggest case of faking it you've ever seen? Story 1. 30-year-old woman came to the ED with such excruciating belly pain. Paralyzed. Oh God, it hurts when you press there. Must have oxycodone now. ED doctor said if she can get out of the ED bed and do 20 jumping jacks we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. Story 2. My mom's an ER nurse, and she said once some lady came in and complained that she had the whooping cough. And whenever she coughed, she followed it with a loud whoop. Story 3. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So, she started telling her teachers she couldn't read what was on the chalkboard. And she'd squint at home, and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses. But, the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually, that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision, and her sister only had astigmatism. They all realized she was faking it. So, the doctor told her parents, in front of her, that she'd need some pretty intense eye surgery, so she'd be able to see without glasses. They even wheeled in a machine to make it convincing, to say they could do the surgery, right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. Story 4. I'm an ICU and ER nurse. We get a lot of malingering in the ER. One day, one of our frequent flyers came in and started faking a seizure in triage. Now, obviously, I know this lady, and she's fake seized a million times before. But this time, it's in the lobby in front of about 30 people, who have no way of knowing that it's fake. She's lolling around on the floor, making a damn fool of herself, and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing, so she did. Story 5. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up too, but caught herself halfway through. Then, she threw her hand back into her lap and pretended to be staring off into nothing. Story 6. Resident here. On nights, I had a gentleman pseudo-seizing. Really sad, as this is common with PTSD and other mental health issues. Sternal rubs weren't doing anything, basically rubbing a knuckle in their chest, which we often do to wake somnolent patients, but has other uses. So, I'm casually talking to him, telling him what we're doing. I do this with patients that can hear me or not. Then I tell him we're going to raise him up in the bed, and go to put an arm under his shoulder to move him. He looks at me and says, "I can do it myself." He proceeds to move up in the bed, then continues his seizing. Bless his heart. I hope he gets the help he needs. Edit, yes, the bless his heart is sincere. Mental health is a drastically undertreated, not addressed aspect of our medical system, and I have great compassion for these folks. Yes, this has to be treated as a real seizure until proven otherwise, in case it does happen to be real. Thanks to everyone who brought up that pseudo-seizures are antiquated, and that or psychogenic non-epileptic seizures, is much more accurate. Meaning not having changes in brainwaves consistent with epilepsy on EEG. Also, sternal rubs are very painful, and are used sparingly when it is necessary to ascertain a patient's state, when powerful interventions depend on the information we are able to rapidly acquire. Not something to be taken lightly. Anyone with NS, there are clinics that can help you. Please seek out help. There is no reason to be ashamed, though ignorance and judgment is prevalent in any field. Story 7. When I was a kid, I learned I could fake sick and get out of school. So, 1 to 2 days a week, I would get a migraine, hold my head, and complain, and I would get to go home. Eventually, my parents took me to a neurologist who said, "Maybe you just don't let him eat chocolate and sugar?" I admitted to faking and was grounded for a long time. Story 8. I grew up the opposite way. I would get 3 to 4 migraines a week, but everyone thought I was faking it. Because most days I seemed fine, just because I was learning how to deal with them and try to act normal. It wasn't until 8 years after they started that I went to a neurologist who said I have chronic migraines, which I dealt with unmedicated for 16 years. Now I'm on medication. I feel like my childhood was wasted. Story 9. I have a sort of opposite angle story for this one. A friend of mine is completely blind, as in, eyes removed as a toddler, blind. She had a rare cancer. She's worn glass eyes her whole life to keep the sockets from sinking in, as well as to limit the jarring appearance. Well, she had a new doctor she was seeing, so to speak, to get fitted for new glass eyes. I think that was why. When the tech brought her in, they told her they had to examine her eyes. And asked her to read the vision test chart. U.M? She kept trying to explain, she is blind. And they were stuck on examining her. Whoa. Your pupils aren't responding. No F. She finally got so frustrated, she popped one glass eye out and said, "Here. Now you can check it out all you want." She, apparently, always would pull that gag on folks doubting her and or teasing her. She's awesome that way. Edit. Whoa. I stepped away for some dinner and came back to find this comment about my badass friend getting a flood of upvotes. She will love that. A few details, I don't know much more about this story, as she was telling a series of, oh my god. Are you serious? Encounters she's had during her life, and this was my favorite. Second favorite is probably the cop who showed up unexpectedly at her house. Turns out the call was for next door, and insisted she had to be high as hell because her pupils were dilated in bright light. Yes. This was definitely a tech and not the doctor. And yes, her glass eyes are amazingly realistic, and I had no idea at first. She also endures regular BS for her guide dogs. She's on her third or fourth, I think, now. A very large and sweet German Shepherd. I want a pet so bad, but can't just yet. He's too friendly with strangers, that's great normally, but she doesn't want to be yanked across the room, sidewalk, or street because he wants to be your new best friend. She got serious flack at an airport, want to say it was Denver, way back pre-9/11 because at the time, they were insisting the dog couldn't go on the plane with her. Made her miss her flight, She has sworn never, ever to go through that airport again. And now, people with pseudo-support dogs really piss me off because they're little untrained, purse-riding puffballs lose their sheesh, barking and launching at her 100-pound shepherd that spent years getting certified. Story 10. Taking trauma call during surgery residency, I had a prisoner come in after a fight and claim he couldn't move or feel his legs. All the CT scans and MRIs were normal, however, we would shield his legs so he couldn't see them, and poke them with needles and other sharp objects with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with SIWRA, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week, no improvement. Always had one guard with him. One night, they were down in the lobby, watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." The guard left him alone for 2 minutes. The patient was last seen sprinting down the road, naked, butt cheeks flapping in the breeze. He made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con. Story 11. Dermatologist here. Patient was convinced she had a melanoma and needed a biopsy, and would need to be on workers' camp. I told her it looked like ink from a marker. She demanded a biopsy. I wiped the area off with an alcohol swab and showed her the ink, and that there was no spot on her skin anymore. She stormed out, threatening to sue. I'm just glad I cured her melanoma. Story 12. Had a patient come in for a fall, who now couldn't move their legs at all. Did a bunch of tests, didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk. So, I update them, saying everything is fine, tests are negative, you can go home. Patient gets up, gets dressed, and walks out without a word. Story 13. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery, without intervention. Story 14. Not a doctor, but worked in healthcare for nearly 20 years. While taking a break from the ICU, due to it being emotionally draining, I worked in home health for a bit. I had a patient who clearly had Munchausen syndrome. On a daily basis, she would call her insurance to see what things would be covered if she was diagnosed with this or that. She called her doctor's office an average of 5x during my shift with her. She would report all kinds of non-real symptoms. She pestered the doctors into doing exploitative laparoscopic surgery. Of course, nothing was found. One day, I walked in, and she was rubbing her incisions with rotten cabbage, trying to get it infected. She wasn't seeking pain meds, except to sell. Really, she was just as happy with antibiotics or stool softeners, anything. As long as they wrote her a prescription, and she got to go to the pharmacy, where she did a whole song and dance for them too, claiming allergies and reactions. She always increased the exaggeration of her story, too. One time, she fluttered her eyes, after making sure I was looking, and said she lost consciousness in that half a second. She called the doctor and claimed she lost consciousness for 5 minutes. She called the insurance and claimed it was 10 minutes. She called the pharmacy and claimed it was 30 minutes. Then, she called 911 and told them she woke up on the floor after losing consciousness for 4 hours. The worst thing about her was, she was a mom. Her son was 28 at the time, And by all the stories of his childhood illnesses, and all her saying how he is severely disabled, I knew she basically fucked up his childhood with Munchausen by proxy. She portrayed him as being severely disabled, and that's why he would never find a wife. I met him, he was healthy and of average intelligence. He wasn't looking for a wife, he was gay, but she refused to accept that. Working with her was so miserable that I took a couple years off from any and all healthcare after that. Story 15. Physical therapist here. A working mom comes into the clinic with her infant in a stroller. She's limping, as if she's got a nail in her foot, wincing in pain, and with tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bouncing down the sidewalk, hips swaying, full stride, going places. We were all fools. Story 16. Young, 18 to 20, woman went running into a small, rural hospital ER, pretending to have abdominal pain. A police officer had tagged her, going 40+ km over the limit, which was stunt driving as per the new law in Ontario, impound and license suspension automatic. The cop followed her into the ER and, apparently, said he'd be waiting for her when she left. Locum staff, such as myself, were housed at a small BAMB about 15 minutes away, and the ER had pre-printed order sets to be done before we arrived. When I arrived, she flat out admitted that she just came in because she freaked out and didn't stop. I told her we'd give her 45 minutes to call her parents/family, before I booted her. Except, BHCG came back positive, and subsequent ultrasound came back, showing extremely early ectopic. Officer figures out something is up, when he hears air ambulance call coming over radio. She was completely asymptomatic and just worked out that she dodged both charges and a life-threatening issue by accident. It was definitely a WTF moment. Edit, a little more info. Small rural hospitals in northern Ontario often service areas from more than an hour's drive away, and still only have a catchment area of 2,000 to 3,000 people. When on call, it was just that, we would do our days in the community clinic, then maybe hospital rounds, then go home and be on call. We wouldn't be at the hospital, there wasn't an on-call room where you would stay, for example. There were lots of times that you'd go a full night without being woken up. Or maybe just a call from the acute care inpatient wing? Locums were short-term contracts for places that didn't have full-time medical staff for whatever reason. It's hard to attract clinicians if you don't even have broadband internet in the community. They generally pay very well. Story 17. Reminds me of an old post where some hobo came to the hospital speaking incoherently. And they decided to give him a checkup anyway, to show to the students, it was a university hospital. And he turned up to have some issue with the liver. After they treated him, he became lucid, and it turns out he was a professor, on his way to a lecture, when his liver stopped functioning properly. And he couldn't think clearly because of that, so he was just wandering the streets for a while. Story 18. Pediatric neuropsychologist. Got a referral for more or less consolidation care. Patient was 13, wheelchair bound, required therapeutic oxygen, seizures, arthritis, musculoskeletal problems, suspected autism. Completely nonverbal, severe behavior challenges, the list goes on. He was being followed by at least 8 different specialties, clearly, none of whom were communicating with each other. And medicine list was 18 prescriptions long, including some incredibly heavy-duty stuff, antipsychotics, antiepileptics, that sort of stuff. Got kicked to me after his umpteenth ER trip because the ER doc felt something was off, and he needed someone to look at the whole picture. Factitious disorder by caregiver, or Munchausen by proxy. All of the original symptoms were parent-reported, going back to about a year old. It had possibly started with a febrile seizure, fever-induced seizure, in infancy, but this was never witnessed by anyone but mom, so it's unclear. She had been telling doctors different things. She was convinced her son had all these disorders, telling him he was going to die any day. He got a Make-A-Wish trip, donations, etc. He was removed from her custody and taken off most of his meds. Within a few weeks, he was out of the wheelchair, playing basketball, no oxygen, super talkative and friendly, no behavior problems. He did have a pretty significant intellectual disability, but there's no way to say if that was organic or the result of the prescription cocktail he had been fed all his life. Hopefully, with some good therapy and a stable home, he can continue to make progress. Story 19. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego, because the hospital is in Oswego, by faking seizures. Sometimes, when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently, the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. Story 20. We had a family calling for a Medicab, a cab paid for by income-based insurance, from somewhere out in the sticks to our ER in a college town every few weeks or so. The mom would be seen for some ailment or the other. And the rest of the family would go to Walmart, go to the mall, do all their in-town errands. She was basically faking an emergency illness every few weeks so they wouldn't have to pay for a cab to get their shopping done. Story 21. This patient comes in for back pain with weakness of the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy, and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. The patient is infuriated that they're being discharged, yelling and screaming about how they aren't better, how they're disappointed in the institution, blah blah blah. They said one particular thing that still clearly stands out: 3 to 4 years later, I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home before they even have the chance to see me? My attending and I leave the room to arrange things with the nurses. We go back in, and the patient is out of bed, standing up in the middle of the room. Miraculously, the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding abuse of medical services. Story 22. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking, tried to keep his eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper who is now unable to make videos or earn a living. I exclaimed, to have heard of him before, and very excitedly asked him to search and show me his YouTube channel on my phone, so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app, and typed away in the search bar. Oh, and of course, his eyes were back to normal and focused. Story 23. One time, my roommate, who is an ICU nurse, came to see one of my indoor soccer games. During the game, a player on the other team went down hurt and started screaming in pain, swearing, and rolling around while holding his ankle before he was eventually helped off the field. He then limped over to where the fans sat and watched the rest of the game, brooding in silence, before he left early. After the game, my roommate told me he was going to go over and see if there was anything he could do to help, until he saw that the guy was limping on the wrong leg. Story 24. Was told this one by a fellow nurse I used to work with when we had a psych floor. It's not unusual for psych patients to stash things in various orifices. This one woman was convinced she was impregnated by a ghost-like figure, but no one would believe her. So, one day, she started complaining of massive pelvic and uterine pain. She called them contractions. So, the doctor goes to do an exam. The doctor feels something larger in there, so they prep a table to get the object out, which was quite large. So, the wonderful third year, helping with the procedure, starts hearing this woman complain of contractions and yelling things like, "Should I push? I'm gonna start pushing." The doctor, trying to work forceps around this woman's parts, as to not hurt her, finally goes, "Got." And, as he starts saying it, he pulls out a baby doll. Head only. The poor med student did the wobble. Went all flush, had problems keeping balance, and about took a dive. I was told he didn't live that down the whole rotation. Story 25. Not a doctor, but am a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was, no one had ever seen her actively bleeding. She'd call, saying that she had bled down the toilet but flushed it. All the examinations we did came back completely normal, with mostly no evidence of any bleed whatsoever. On occasions, during speculum examinations, we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding. I walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave was because she had 5 noisy children at home, needed some rest, and knew we wouldn't admit her to the hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. Edit. So, there are a lot of questions regarding birth control and questioning her parenting, so I thought it best to add an edit. This patient was not, by any means, a benefit seeker. They were a hard-working and loving family that had full-time jobs. She had been booked in to have her tubes tied, but found out a week before the procedure that she was pregnant with this baby. She just couldn't cope during the pregnancy and became very mentally unwell. She did not realize the implications or understand the fact that she was causing massive harm to herself and her baby. She was referred to our perinatal mental health team and treated for psychosis. They also had a lot of input after she had her baby. She ended up having a C-section and was sterilized at the same time at her request. By all accounts, she is doing very well now. Story 26. Obligatory, not a doctor. I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe, disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions, and signed it off, the guy asks the doctor to check his shoulder, which the doctor does, and asks, "How did you injure it?" Guy says, "Playing rugby for a competitive team?" "Really?" says doctor. "How long have you been playing for them?" Guy has been playing and training the whole time. Doctor puts this info on the insurance form. Doctor loses his sheesh in the staff room, laughing. Next week, the patient loses his sheesh in reception because his insurance has been cancelled. Story 27. Guy came to the ER, I was a nurse at the time, for a stomach ache. While asking him about his history, he randomly mentions a fight with his girlfriend, where she left in a tizzy, and he fell asleep on the couch. 20 minutes later, when we see the CT, he has a satellite cable remote wrapped in a condom, lodged in his rectum. I suppose he intended to frame her. I didn't get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. Story 28. I am a nurse, not a doctor. I once had a patient who worked as a janitor in a hospital, so he knew enough to fake some symptoms. He was seeking pain medication, complaining of chest pain, and requesting morphine. He was thoroughly evaluated for everything cardiac related and turned out to be fine. Then, when he was being discharged, he tried to claim gastrointestinal discomfort. Again, he was cleared of any issues. He faked chest pain yet another time and was cleared once more. Now, he's my patient, and I'm a new face to him. He starts telling me he's having abdominal pain. Called the doctor, knowing this guy's history. The doctor says he'll be up to see him soon. Meanwhile, the patient asks for a ginger ale, classic for someone claiming a stomach ache. I decide it's a good time to head to lunch. Not long after, my coworker storms into the lunchroom, absolutely disgusted. She tells me this guy had taken a dump in a basin, poured ginger ale over it, and then tried to convince her he was experiencing fecal vomiting. Naturally, he insisted he needed Dilaudid immediately for the pain. I walked into his room, and sure enough, there it was, a pile of feces sitting in a puddle of ginger ale. I told him I'd have to take away his food and drinks and that we'd need to place an NG tube. Suddenly, his tune changed. He admitted to faking it. Story 29. ER nurse. Bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with the specimen cup that literally has a piece of concrete in it. Looked him in the eye, expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. Story 30. My next door neighbor would drink a 12-pack of Mountain Dew a day and keep kidney stones year-round to get pills. He had a pretty sweet deal, too, getting 90 Laracettes, 90 Xanax, and 90 something else, I forget, every month from his doctor. He just couldn't stop doing other drugs and pissing dirty. I tell this story just because I was impressed with his determination to hurt himself and get surgery once a year just to get high. Like, the absolute determination that takes. My mother is a recovering addict and had been getting the same pills around that time, and I don't recall her intentionally hurting herself. She just went with already messed up issues before she got herself into a clinic to get clean. Story 31. When I was a medical student, I worked in the pediatric side of the emergency room, and we would give popsicles to all the kids. One afternoon, an 8-year-old came in with his father, and I asked what was wrong. The kid couldn't remember what he complained about to his dad, and the dad couldn't remember why he brought his kid in. The kid's mom was a nurse, she was working at another hospital at the time, and she was the one that would keep track of these things. Anyway, after a few minutes trying to figure out what was going on, the kid asked, "So, can I have my popsicle now?" The kid was 100% healthy. Unfortunately, we reinforced bad behavior, and both the kid and the dad subsequently left with popsicles. Story 32. Years ago, I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times, and she showed no improvement. One Saturday, I was on call, but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood, because, wonders behold, there she was, wearing old lady spandex, power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic, with her crippled get-up on again. A few weeks later, I got the subpoena for the deposition, and it all became clear. Story 33. I'm a surgery resident. When I was on my trauma rotation, we had a patient come in after an MVC, with questions that maybe the patient had seized and that had caused the accident. So he's in the trauma bay, and starts shaking. The trauma nurse goes, "Oh, this isn't a real seizure." And the patient stops shaking, sits up, turns to the nurse, and yells, "You don't know an effing thing about me." Story 34. Audiologist, hearing specialist, have worked in the private sector with legal claims, and with the VA handling veterans' claims of hearing loss. With those two populations, having people faking hearing loss is pretty common. Now, as a professional, for me, the hearing test starts when I call the person's name from the waiting room. In a normal voice, I call them. If they answer, I already know that they're normal, no worse than mild loss. This was the case with this guy. He answered and came in. We had a normal conversation. So, case history over, time to test. I give the instructions over the headphones at a reasonable 50 decibels. Decibel, raise your hand when you hear the tone. 50 decibels tone should be easy and clear, but he doesn't raise his hand. I go up, and up, and up. Finally, I'm putting a 100 decibels tone in his ear. He's flinching from pain. It's so loud, but he doesn't raise his hand to indicate he's heard the tone, even with re-instruction. I immediately know what I'm dealing with. I have taught entire classes on how to spot and try to get estimated true results from people trying to fake it. Long story short, I wrote a damning report outlining all his inconsistencies and faking behaviors. The thing that made this one so memorable is that we had such a pleasant conversation before. He was a fire chief. I have firefighters in my family. It was one of those where you think, if it wasn't for professional/patient appropriate distance, we could hang and be friends. But then, this guy was determined to get a disability rating, and it just pissed me off. Another story about a teenager. She comes to me for her annual state-mandated look-see. It should be routine. Previous test from a certified audiologist shows a flat 70 decibels sensorineural hearing loss. She shows me her 4-year-old BTE hearing aid, looking brand new, pristine. I'm suspicious, so looking down at the aid, so there are no visual cues, I say softly, "Do you wear this every day?" She responds, "Yes." I knew right there it was game on. I start with non-behavioral tests, which are tests that require no response or anything but sitting there quietly. There's one test called an OI that we can even test newborn babies and know if their hearing is reasonably normal. With this teen, her responses were unquestionably robust. No way in hell this kid has a 70 decibels hearing loss, she fooled the previous audiologist. From there, it was just test, retest, re-instruct, disrupt her auditory reference points. Wear her down until I get responses at the outside limits of normal. Busted, no question or doubt. The doctor was pissed that they were scamming the system for a monthly disability check. He really barked at them that he was going to report them. I couldn't tell if mom was pissed at me and the doctor, or if she was pissed at her daughter for blowing it. My favorite story, though, is working on an active base, and SM's wife comes in with her 6-year-old kiddo, who's suddenly having trouble at school. I go to test the kid, and he's able to answer open-ended questions at 20 decibels, but it's giving me a PTA of 40+. Come to find out, it's because the mom recently had another baby, and he wants to stay home from school with them. Mom and I had to have a long talk about sibling jealousy. Story 35. I had a patient, when I worked in an ICU, that was sedated and on a vent. A family member showed up out of nowhere and was staying day and night. I got pretty suspicious of them, because they were clearly lying about knowing this person. I just talked to the fake family member about how it must have been sad, since they just celebrated their birthday a week or so before getting ill. This person said it was a wonderful party and such. To which I replied, their birthday hadn't occurred yet and wouldn't for months. Turned out, when security came, it was a homeless person who snuck in and found a room with a sedated patient and decided to make it a place to stay. Needless to say, security to enter the ICU was absolute BS. That's it for now. See you in the next post.